Good afternoon, everyone. Welcome to the Board of Health meeting. Today we have a short agenda. We've got a ceremonial activity at the beginning, which is the Walk Friendly Ontario Award. Then we have 3 consent items, an update on how the Public Health Department is monitoring retirement homes after a change in provincial law in 2010. A change to how Healthy Babies, Healthy Children's budget is operating. They're going to eliminate one position, but they have found that supplying each of the public health nurses in there with a cell phone that allows them to communicate by text message with clients has cut down the number of missed employment appointments, which means they do not need the person. The Community Food Security Stakeholder Advisory Committee report is minutes are being accepted by the Board of Health. And then we have a presentation from the Air Quality Task Force. And this one is fairly important because, of course, air quality matters to us all. We all breathe in the air. But also because in the city of Hamilton, in an average year, we record 186 premature deaths, 395 respiratory hospital admissions, and 322 cardiovascular hospital admissions. That's every single year. And then one discussion item, which is item 9.1, and it's just the updating the list of parks where smoking is prohibited. One motion, which is from Councillor Brian McHattie, and he's asking public health staff to look at strategies to address the problem of disproportionate negative health outcomes in our poorest neighborhoods from cancer. Following the open session business council as Board of Health, will go into closed session for the performance review of the Public Health Services Management Team. Quorum for this meeting is 9. The chair is the mayor, and as soon as we have 9, the meeting will begin. Due to the extremely annoying buzz in the sound system, I'm going to keep us from the house audio until they do reach quorum. You will have silence until that does occur. Once again, we're just waiting for quorum to be reached here. We currently have 7 councillors. We need 9.
Health, Mr. Clerk, are there any changes to the
Yes,
agenda?
we have 2 changes to today's agenda, Mr. Mayor. We have Mr. Sean Comer respecting the development of a new approach to dealing with pests and rental units in Hamilton, and that is all in today's agenda.
Okay, and so a motion to approve the agenda is amended. Councillor Pearson, Councillor Johnson. All in favor? Thank you. Are there any declarations of interest? Hearing none. I would like to invite Sharon, who is a member of the public health nurse with the city, and Steve, who is project manager with Public Works, down to the circle. Sharon and Steve have been involved with the city's initiative in the Walk Friendly Ontario project, where the city has recently received silver designation. The initiative looks to raise the profile of walking in community planning and design, and encourages municipalities to create and improve spaces and places. And so Sharon and Steve, please take the microphone and regale us with your accomplishment. Welcome. Thanks, Sharon. Steve, go ahead.
Thank you. We would like to present this Walk Friendly Ontario Award, Silver Designation, to you, Mr. Mayor.
Thank you.
I want you to know that we worked on this project with all of our city departments. We had over 200 questions that we had to fill out, and all city departments and over 27 staff that helped us with this. So we'd like to present this.
Well, thank you very much on behalf of the Board of Health and Council. Canada's Walks is proud to present the city with a silver level walk-friendly community award in recognition of the progress in creating and improving the conditions for walking. So that will hang proudly in the mayor's office. And that goes along with it? That is awesome. And of course, we have the proposal to reduce the employee parking spaces by 50% before the next year, which will also encourage walking. No, I guess we're not doing that. I walk. Thanks so much. And congratulations. Well done.
Congratulations.
Thank you. Great. All right. Who walked to work today? Councillor McHattie, did you walk to work today?
You did, sir.
All right. Joey.
You should all live downtown.
How many would have walked to work today? That's more like it. Okay. Motion please to approve the minutes of our last meeting. Councillor Johnson, Councillor Pearson, all in favor? Carried. Thank you. We have a delegation before us. As indicated in his letter, Mr. Comer has been before the board and would like to address us once again. So a motion to approve the request to speak at the January 13th board meeting. Barr, Collins, all in favor? Carried. Yes.
Question.
Speak to that. Councillor.
I think it was Councillor Pearson before me then.
Well, Mr. Mayor, and I'm just going to ask if that I should declare a conflict. I just read through this. This is rental properties. I know it's saying apartments, but as a owner of rental properties, I'll declare
Conflict noted. Councillor Powers.
Just a question. This gentleman has been before us before. Will this be new information that he will be providing to us, or will it be a repeat? And I would ask that perhaps the clerk of the committee make that inquiry for the gentleman before he appears before us in January.
I believe the information is further development of his previous delegation request, but I can speak to Mr. Comer and confirm that prior to his appearance.
Okay, and so once again, that's approved, bearing in mind the question that was just asked. We have consent items 6.1 through 6.3 before us. Any discussion respecting these items? If not, a motion please to receive these items. Councillor Pearson, Councillor Johnson. Yes, go ahead.
This in the Retirement Act and the requirement. So obviously a number of our residential care facilities, some of them may, because of the criteria, meet the Retirement Act designation. And there's not only the issue of how they're inspected a little bit differently than the RCFs, but they're also required to upgrade their fire systems as well. Can somebody help me? So the funding for the inspections on, if we find an expansion of the Retirement Act and facilities in our community, who's picking up the cost of those inspections?
Through you, Mr. Chairman, could you have the councillor please clarify that question?
Sure. So what's called the retirement homes and the Retirement Homes Act, because of the criteria, there's a number even of RCFs, which I know there's one up in Waterdown, I believe, that meets the qualifications of a retirement home. Thereby, their inspections will now be done by, I believe, an RN, by the ministry.
Through you, Mr. Chairman, last year when the Retirement Home Act came into force, a number of homes became designated under provincial legislation as retirement homes. Those homes are inspected by the authority, a provincial authority. They're not inspected by the public health nurses that we have employed to do the residential care facility schedule inspections. So they're exempt from those nursing inspections that our staff do under the RCF bylaw. But those types of inspections are carried out now by the province for those homes that are regulated by the Retirement Home Act. We still have nurses that go into those homes that are not regulated by under the Retirement Home Act. Those are homes that are licensed as residential care facilities and need the requirements of Schedule 20 under that legislation. So we do have nurses that still go in to provide that service only in those homes that are licensed as residential care facilities and not licensed as retirement homes.
So can you help me? We got homes that might be both. Who is the superior authority in regards to the inspection?
Through you, Mr. Chairman, we work with the Retirement Home Regulatory Authority on those homes. We've been having regular communication. There's 5 of them in the city of Hamilton right now. When it's an issue that pertains to the bed that is occupied by a person under the residential care facility, then those regulations apply. When it's a bed that's occupied by a person under the Retirement Home Act, then the retirement home people, inspectors have to do their inspections. It's an awkward situation, and we outlined this in the previous report, indicating that there may be conflicts at time. Part of this report here is to indicate that we haven't had any conflicts at this time with those 5 homes, and that's a good thing, because some of the fears we had about trying to have dual enforcement we thought might be problematic, but we seem to have a good relationship with the province in getting the work done in these homes. So that's part of why we came back to report back on this.
I appreciate that. I think that's the feedback I'm getting is that it's somewhat complex. And I was hoping that that in those situations, I mean, they're getting double inspected, quite frankly, by, and I know there's slightly different standards for Schedule 20, but again, you have the ministry going into the home and doing their inspection, then you got the city going and doing their inspection, and again, there's only one taxpayer, so I was wondering if there's an effective model in those situations that could alleviate the pressure on the city.
Through you, Mr. Chairman, I think part of the problem is when the Retirement Home Act came into existence, legal authority for the province said that they did not want to take on any type of enforcement in a regulation, in a home that isn't covered by their authority or their regulation. And so trying to, I guess the question would be, we'd have to talk to our legal people to see if we have the ability to take on their authority. I don't think they have any ability to take on our bylaw work. And so we are going to have those situations where a home has 2 different inspectors, but we actually are in a good position because we take care of certain aspects that are very, very similar to what they take care of. So we really don't have a lot of overlap. Some of the conditions, some of the requirements are a little bit different, but I think you'll find that our bylaw is a little more stringent, and therefore we provide just a little bit more ability to protect the needs of the residents in those situations.
The only reason I'm highlighting is that I still believe that through dialogue and discussion, I believe our bylaw is actually superior in regards to the stringent things we expect within our retirement homes, or sorry, our RCFs. And I think there's very little that the ministry has that's outside of what we already cover within our bylaw. So I would hope that in those situations that there might be a coming together of minds, and instead of having 2 inspections on those facilities, we can come to some formal agreement. So I just want to highlight that, Mr. Chair.
Thank you. Councillor Clark, did you have a comment or a question?
Question. The long-term care facilities in the province of Ontario, they have a website with the Ministry of Ministry of Health and Long-Term Care that outlines violations. Facility, it reports how many violations they had of the Long-Term Care Act, I guess the inspections. Does the Residential Care Facility Authority have a similar program where the public is aware of any violations to the Act?
Through you, Mr. Chairman, the Retirement Home Authority, I don't believe they have a website yet, but we can check on that. Our residential care facility inspection program does not have any kind of open data reporting system. That's something that if council would like us to pursue, we can come back with a report on how to implement that, but we'd have to do a serious amount of consultation with the Dom hostel operators, which is really the majority of those people who fall under our bylaw now.
So I guess, Mr. Mayor, if we could just ask the staff to check with the province authority and find out exactly what information they're making public with regards to violations. The Long-Term Care Act, I would suspect that that would be a good thing in terms of public accountability, and then we can go from there once we have that information, sir.
All right, thank you for that. And so we have it moved and seconded. All in favor? Carried on the consent items. We have a presentation now respecting the Air Quality Task Force Action Plan. So I'll ask Matt and whatever other staff required to come forward on that. Councillor Marullo. Okay.
Good afternoon, Mr. Chairman and members of the Board of Health. I am pleased to be before you today to present the action plan of the Air Quality Task Force that convened to bring forward recommendations for your consideration regarding air pollution in Hamilton. Some background. The Air Quality Task Force last year we met at Board of Health, and it was established as a result of a motion passed with a mandate to investigate and make recommendations to the city on actions that can be taken to reduce air pollution in Hamilton. This motion was brought forth as a result of concern from local citizens who were residing in neighborhoods in close proximity to Hamilton's industrial core as they relate to air quality. The Clean Air Hamilton annual report for 2013 reports that despite long-term reductions over recent decades, the annual values for pollutants known to be hazardous to human health, the particulates, sulfur dioxide, benzene, and benzoate firing, have all shown modest increases over the past 3 to 4 years. In Hamilton, mobile air monitoring studies report higher pollutant exposures measured along arterial roads, major highways, and intersections due to emissions from automobiles, light-duty, and heavy-duty trucks. The Air Quality Task Force participation was open to interested members of Clean Air Hamilton. The task force chairperson was myself, as my portfolio lead within public health services allowed me to help schedule the meetings and liaise with the members of Clean Air Hamilton on the task force. The task force met on a monthly basis beginning in January 2013, and the task force consulted with stakeholders in order to develop its recommendations to the board about actions that should be taken and could be taken to improve air quality. So the vision for the Air Quality Task Force was to support actions that can be taken to reduce air pollution in Hamilton. And that those actions have a potential result to improve human health due to decreased exposure to air pollutants, that there is a sustainable environment which receives fewer and lower emissions and produces less detriment to the local airshed, a higher quality of life for individuals who live and work in the city of Hamilton, as well as a legacy for future generations that includes a cleaner environment. So I would like to take a moment to acknowledge the individuals who volunteered their time and effort to provide input and guidance to the Air Quality Task Force. Those individuals are in the gallery now. Dr. Linda Lukasik from Environment Hamilton, Executive Director. We've got Mr. George McKibben from McKibben Wakefield Consulting. Dr. Dennis Core, also from Core Associates. And Brian Montgomery, our City of Hamilton Clean Air Coordinator, as well as Environmental Health Specialist Sally Radisik. She's also in the gallery present today. Not present is Karen Logan from Hamilton Industrial Environmental Association, as well as Mr. Andy Sebastian from U.S. Steel Canada. Mr. Slater was not actively on the task force. He's a member of Clean Air Hamilton. Air Quality Task Force recommendations. The recommendations are taken on actions that can be taken to reduce air pollution in Hamilton. So the recommendations are based on a suite of different actions to address the complicated interaction of Hamilton's unique geography, multiple sources of air pollution in our city, and the distribution of land uses and transportation infrastructure within our city. So the Air Quality Task Force recommendation is to look at an ecological type of map. The Air Quality Task Force recognizes that an integrated approach was needed with citizens, the community, and the government. So we were trying to find the area where citizen concern and community concern and government concern all overlap. And that was the area within those concerns that we focused on actions that might be taken here in Hamilton. So the recommendations from the task force are built upon air modeling and monitoring, planning, education and outreach, and municipal action. So the recommendations expected to work synergistically to achieve air pollution reductions. So the first recommendation to discuss here is the recommendation around an advanced airshed model. And it's that Public Health Services, in partnership with Clean Air Hamilton, be directed, pending identification of a funding source, to procure the development of an advanced airshed model for the City of Hamilton. An airshed model would be useful to the City of Hamilton, which would allow us to characterize air quality across Hamilton. It would allow for the determination and contribution of different sectors to air quality. It would allow for the development and prioritization of more effective air quality improvements and actions that can be taken. Also within the Air Quality Task Force Plan is a recommendation that staff, in partnership with Clean Air Hamilton, be directed, pending identification of further funding, to procure neighborhood mobile monitoring surveys in identified neighborhoods. There is a recommendation that on air quality related guidelines, where Public Health Services staff work with planning staff to develop air quality related guidelines for new and redeveloping neighborhood land use planning, as described in recommendation 3 of the Air Quality Task Force Plan. There is a recommendation to review the Town of Oakville's particulate matter reduction bylaw. Public Health Services staff work with municipal law enforcement staff with assistance from legal services to review their bylaw and report back on how it could be adapted for similar bylaw in Hamilton. It was in August of this year at GIC committee that Councillor McHattie raised that motion and initiated that work. There's a recommendation to review existing bylaws and enforcement processes. That public health staff, with support from municipal law enforcement, review existing bylaws and enforcement processes, i.e. the streets bylaw, that serve to lower the generation and dispersion of particulate matter and report back to the Board of Health on possible areas of improvement. There is a recommendation to support street sweeping program enhancement, where the Board of Health, we're recommending that the Board of Health support the recommendation in the street sweeping program enhancement that was submitted in September of this year by Public Works. They have submitted an enhancement request deferred to the 2014 budget process, whereby street sweeping improvements could be made in certain heavily loaded areas with particulate matter. There's a recommendation to coordinate education programming, that Cleaner Hamilton continue to coordinate education programming among community partners with regard to promotion of green infrastructure, to organizations and governments, air quality outreach programming within Hamilton schools, which has been a popular program of recent time, and community-based environmental monitoring, as described in the recommendations 4, 7, and 8 of the AQTF action plan. And also there's a recommendation that public health staff work with the Ontario Ministry of the Environment and Cleaner Hamilton to develop and conduct particulate matter control workshops for local businesses and industries. And that's also described as recommendation 6 of the AQTF action plan. So members of the board, I would just like to conclude by saying that every so often, there comes a turning point in decisions that need to be made, and that can be made at a municipal level regarding control of air pollution, and those decisions that can set a course over time to improve those conditions. These recommendations before you today are some of those where adoption of these would lead to some good work that would really seriously look at where pollution is coming from in our city and focusing efforts on how to put programs and mitigation strategies in place to lower that pollution. Thank you very much, Mr. Chair.
Thank you, and I have speakers list, Matthew, so I have Councillor Marula, McHattie, Johnson, and Clark. Councillor Marula.
Thank you, Mr. Mayor. Matthew, I want to thank you for the presentation. I know when I brought forward the motion for the air quality task force, there was some reluctance on the part of public health staff, and we've come a long way with respect to where we were and where we are today. And I do want to commend you and the rest of your team in bringing it to fruition here today. In saying that, I also would be remiss not to thank the residents who attended that particular day that led to the motion, and that would be Barbara Friend and Lorna Moreau, and who are East End residents. In looking at what's before us, I noticed that it's somewhat unprecedented where we're looking at a mandate that really is a provincial mandate that we're trying to tackle at the municipal level on a volunteer basis. So through you, Mr. Mayor, from your perspective, Matthew, is this somewhat unprecedented to have such a, I guess, a global view and recommendations accordingly to deal with this type of endeavor at the municipal level at present?
Through you, Mr. Chairman. I don't believe it is unprecedented that a municipality would be interested in doing this, Mr. Councillor, but I do believe that this plan being put forward is arranged in a manner that has some weight to it, and it is strategically thought out. We are asking that with the first tool, the airshed model, which would be very helpful for us to learn more about our situation, that other actions could be taken. I think sometimes municipalities are often discouraged and realize that it's a very difficult thing to get these plans coordinated, but this is somewhat ambitious, yes.
Okay. And to you, Mr. Mayor, I think it's really important to emphasize, only because it seems as if, although people only pay 2% of their taxes to municipality, 100% of the focus is on the municipality. And when you're dealing with a lot of the challenges that this municipality is faced with, it's not as a direct result of this council, but that of other levels of government. And the Ministry of Environment's legislation presently is at a point where, although a lot of promises were made to amend the legislation to have some teeth to it, at present, the ministry continues to have industry self-police. Could you just elaborate on that particular issue and how that might be playing a role in not mitigating the environmental concerns that we're seeing not only here locally, but province-wide?
Through you, Mr. Chairman. Regarding the regulation, I'm not sure I can fully comment on the regulation processes of the Ministry of Environment, Mr. Councillor, but there is, in terms of the emissions of those industries, there is a fair bit of modeling that goes on, what they call a point of impingement, and how that pollution comes out of that facility's geographic boundaries and may impact on the surrounding community. What this is proposing to do is to look at the community more as a whole through a model that would show where pollution is coming from, and it would be our own look at it rather than having the ministry alone assess whether there is risk there. This would be sharing information with other agencies that would kind of point out, oh, we do have pollution in this area, and the model is showing where it's coming from.
Okay. Thanks for that. Through you, Mr. Mayor, with respect to, I guess, more of an emphasis on the public health component, how many people die locally per year as a result of air pollution, locally and province-wide?
Through you, Mr. Chairman, I don't have a provincial figure for you, Councillor, but the latest Clean Air Hamilton report for 2013 estimates 189 people in Hamilton died as a result, prematurely, as a result of exposure to air pollution.
And I believe the number province-wide is in around 2,000 or just above that.
It is, yes, I would say that that's a fair estimate for that range.
And just to put that in perspective, Mr. Mayor, I know Councillor McHattie and I had this discussion. If our murder rate was in and around 180 or some odd, 200 to round it off per year, this community would be up in arms, Mr. Mayor. And yet we have pollution killing nearly 2,000 people a year in the province and nearly 200 people locally. Yet we really don't have the outcry from a community perspective that we need to. So through you, Mr. Mayor, from an awareness campaign or messaging, how can we better put together a package to communicate the severity of what is before us correlated to public health and pollution?
Through you, Mr. Chairman. We do have ongoing campaigns that do try to promote the value of personal use tools for information about air quality, such as the Air Quality Health Index. And we have a promotion of tools that inform the individual on choices they can make. What I think is a lacking part, and that is a gap here, is the air pollution will exist anywhere that when you have manufacturing, when you have any kind of industry, when you have roadways, all of that, there will be air pollution in it. It's just kind of part of our way of life where it's a reality. I think the strategy here would be, how do we get it as low as possible in all of those levels to protect public health? But I don't know if I'm going off from your original question, Councillor, but we do promote programs for the individual on information that they can use to protect themselves. I think to answer the question would be just to increase that promotion and get more intensive with it, finding the higher risk target groups, such as the elderly and the young. They are more vulnerable to it. Finding those target groups and making sure that they understand what is at stake.
But I think most importantly, though, Mr. Mayor, if we were to increase awareness about the nearly 200 people that died annually, that itself would create, I think, the necessary pressure on the provincial government to make the necessary changes to lower that number. That need for efficacy through that knowledge, I think, is where I'd like to focus in on. So through you, Mr. Mayor, what can we do? Perhaps a direction to put together a plan of action would be in order, and at the appropriate time I'll do that. But from your perspective, just on the surface, I guess my point is, how do we make that known to the public, to the level that other issues are known to the public as set, just household information?
Through you, Mr. Chairman. I think, Councillor, the answer to that is actually a comprehensive answer to your question is the plan itself. I think that adoption of such a plan and the adoption of the recommendations in such a plan would take those steps that would ultimately lead to lower pollution in our city, which would ultimately lead to lower exposure of humans to that pollution, which would ultimately lead to a lowering of those rates, either morbidity and mortality, anything like that. I think that this plan does lay out steps where, in a very broad sense, These are actions that will help lower that rate, that death rate that you're referring to. And so I'm sorry if there was a second part to the question.
So just, I guess, providing direction to put together a plan of action for a campaign to increase awareness of the severity of this issue so that we can put pressure on the provincial government to amend legislation to assist in mitigating this crisis.
Right. I think through you, Mr. Chair, I think that comes to the last bullet at this point. Just in developing a more coordinated education program to get community-based environmental monitoring, all of the good work that Environment Hamilton does on creating awareness on these types of issues. That type of program is informative to the public and does help lay out that concern.
Yeah. And I guess how we can make this into a front page story so people understand that nearly 200 people die a year would be helpful too. Lastly, I think what's really unique in this recommendation, I'm glad it was supported, was a motion I brought forward at Public Works, and it really was a shot at the dark, hoping that it would be supported, but to have a Public Works initiative in the street sweeping and somehow bring that into a Public Works initiative, and I see that it has been recommended, and I must say that I'm very pleased to see that. But through you, Mr. Mayor, just on that particular issue and how that plays a role, how street sweeping can mitigate a lot of these issues. Could you just elaborate on that particular issue?
Through you, Mr. Chairman. Street sweeping, there is mobile monitoring information, and we do have data that indicates that roadways are a large source of particulate matter. And when you get into certain neighborhoods within the city of Hamilton, you look at industrial areas where you have a lot of trucking going through, construction, places like that. Those places that could be the mitigation of particulate loading on those streets could be mitigated by enhanced street sweeping. So I hate to sound too basic about it, but if it's like you don't clean up your streets, you're going to be dirty. And so if you enhance the street sweeping, you're cleaning up some of that dust.
And the intent was just to amplify the importance of a very simple exercise by the city that can actually play a role in truly saving not only health but lives in the long run.
Through you, Mr. Mayor, it's direct cause and effect. It's the particulates are there. Let's get rid of the particulates. Street sweeping can help do that.
So on that note, I look forward to council support on that budget enhancement. And on that note, also I want to thank you, Mr. Mayor, and you, Matthew, for the presentation.
Thank you, Councillor. And we have Councillor McHattie, Johnson, Clark, and Powers. Councillor McHattie.
Thanks, Mr. Mayor. So I think you used the term, Matthew, turning the corner on the way that we're responding to air pollution here in Hamilton. And although there's been many, many years we've been leading right across the country with Clean Air Hamilton, this actually gets into the implementation, the actual things that we need to act on to make Hamilton's air quality that much better. So I think you're accurate in your comment, and I want to thank you personally because I know you wear your heart on your sleeve when it comes to air quality issues, and I've heard that from many folks outside of the city who engage with you in the community. So hats off to you in particular for leading this within the Board of Health. Tremendous. And also, of course, to the Air Quality Task Force members, Mr. Mayor, who are in attendance today, as well as the industrial members who assist us in this activity. It is a tremendous day today, and I see air quality improvements as really a key economic development strategy for the city. We talk about public health, we tend to be fragmented into different departments, and Public Works does one thing, Neil and Economic Development does another thing. And indeed, I think probably our strongest dev activity is quality of life improvements. And that's exactly what we're talking about today, led by the Board of Health. So it's tremendous. And I recall the recent leadership as well of the Public Health Department in the transportation area with the Rapid Ready report. Dr. Tran spoke to that, and Dr. Tran was involved in the pedestrian mobility plan that we have. And I understand Public Health is playing a role in land use discussions here, working with the planning department as well. So that's exactly where Public Health needs to be, in my view, Mr. Mayor, taking the lead on health right across the organization. That's certainly a banner activity for us, no matter what we're talking about, what committee or what department we're working in. Just a question, if I can, Matt, the advanced airshed model. That's particularly interesting to me because I've been, along with Councillor Rula and Dr. Lukasik in particular, have been interested in this challenged airshed concept, where there's a number of cumulative effects. Individual, I'm still going to stick with certificates of approval. I know that it's changed, but you know what I mean. Individual C of A's that are approved throughout the city, and no one's really watching the cumulative impact of all those different C of A's, what the air quality across the whole municipality ends up being. And we know that MOE, Ministry of Environment, has been active in Oakville and the Clarkson area, looking at a cumulative impact model there and the challenged airshed model. Am I right that this will give us even more of a case to make, that from an airshed-wide, Hamilton-wide airshed perspective, we've got a challenge, and we encourage MOE to partner with us on this cumulative impact approach, Mr. Mayor.
Through you, Mr. Chairman. Councillor, that sounds exactly right to me, in the sense that this, an airshed model would allow us to see what those overall effects of pollution loading in the environment are, so that we would then, depending on what that result is, everybody has their guesses, and anybody who helped on the Air Quality Task Force talk about this airshed model is very eager and hoping that it might come through, because we're all very interested to see what it would provide for our city. In terms of the resolution, the technology is very interesting about how resolved this information of where pollution in our city is, and it can also do, can describe sectors of where that pollution is likely originating from and things like that. So once that is known, that will give us better options for how to talk to the Ministry of the Environment on, look, if we see a problem here, if we do see a problem, and perhaps their oversight is part of that, it's something that they can help with, we would definitely be speaking to them about that and what strategies might be developed to address it. I don't know if that answers fully the question.
Yeah, no, it does, Matthew, and the challenge, of course, for us is to actually get MOE to the table to have that discussion. And Councillor Rula, Dr. Lukasik, and I met with Minister McPeak about a year and a half ago, and haven't been able to generate any interest in this at this point, but this will assist us in doing so, and we'll carry on that activity. So I just, again, this sort of thing takes some time. You've heard my frustration in the past, how long we take to get to these sorts of plans and the task force's work, but clearly it's been worth waiting for, in my view, to come up with the action plan that we have before us today. And I look forward to the support in the budget process for the items that are going to the budget, and to working with you. And I hope that you will work very closely with the members of the Board of Health on the education approach that's being suggested to be taken. Mr. Mayor, we engage every day with the citizens of Hamilton, and we have a sense of what they're thinking and what might resonate with them. Councillor Rose made some comments on the concern over the premature deaths and the premature admissions to hospital. That's a concern. Later on, I've got a motion relating to the Spectator series on cancer, which is corollary concerns as well. So again, hats off to you, Matthew, and the task force, and everyone involved in this. Appreciate it. Thanks, Mr. Mayor.
Thank you. Councillor Johnson next.
Thank you. And thank you, Matt, and thanks to the committee members. And I did point out that Carl Slater from the Ministry of the Environment is here with us today. He's been a great help in my former life. So it just seems like old home. Matt, you mentioned in your recommendations the town of Oakville. I was trying to find it in Appendix A here somewhere, and I'm a little bit familiar with what the town of Oakville has done. Is there any way you want to give us a little Coles notes of what the town of Oakville did as far as particulate matter and combined airshed, please?
Through you, Mr. Mayor, the town of Oakville had adopted a bylaw, they created a bylaw that looks to fill a gap in regulation of particulate matter where there is no provincial standard for that, and they developed a bylaw to limit the production of particulate matter in Oakville. It's something that hadn't been done yet in Ontario, so they were breaking new ground that way, and it is something that we're hoping can be considered here. We are doing a review. We're going to be working with the MLE folks on what that might look like. We've been working also, we've touched base with the town of Oakville about learning more about how they implemented the bylaw. discussions also with some of the lawyers that have helped develop that bylaw with the city of Oakville. Essentially, it is a bylaw tool to regulate particulate matter, and mostly a planning aspect. I'm not sure how much detail you're looking for, Councillor, sorry.
Well, I'm looking forward to it coming here. I'm looking forward to the report on what the town of Oakville did and what their successes have been and what their challenges have been, because I think that's something that the city council could piggyback onto. They've already set the template for you, so this is going to be, I'm kind of anxious to see that happen. I think it's wonderful. And just to highlight a couple of things, I get really interested when it comes to airshed, not only from my farmer life, but also Arvin Avenue in Fruitland is a hot spot. It's very high with particulate matter, very high with air pollution. So whenever, I know that historically we always seem to tend to certain places in the city of Hamilton as our quote-unquote the fallback guys. This is where we go, especially Stratford, North. But Arvin and Stony Creek has also become a hot spot, so I'm hoping that we can keep that on the radar. So every time I see a report come forward, I'm always anxious to see how this is going to be beneficial to those that live in that area. And the street sweeping, when Dr. Lukasik was here the last time, she not only pointed out the fact that there was industry and vehicular emissions, there was also construction sites. And having 5 major areas of development in my ward, that is a huge problem. And even though some people term it as temporary, and that it's only for a short term until that house is up, that development's up, but it's still there. And sometimes developments don't go up and down in 6 months. They drag on for years and years and years. So I'm really anxious about this, and I can't wait to see the fine details come out, especially the town of Oakville. That's going to be exciting for me anyways. So thanks, Matt. Appreciate all the hard work everyone's doing out there. Thank you.
On behalf of everybody in the Air Quality Task Force, thank you.
All right, and Councillor Clark.
Mr. Mayor, just a few questions. With regards to the Oakville particulate matter reduction bylaw, is that trying to understand what the difference is between their bylaw and all of the recommendations that we're moving forward with here? So is their bylaw completely separate, looking at an item that we're not dealing with in the recommendations that are in the task force recommendations? Is that a fair statement?
Through you, Mr. Chairman. Councillor, the Oakville bylaw, as best as I could describe it as how it's different, would be from a planning perspective. It would be, if someone were to apply under that bylaw, they would be showing documentation, a type of a document called the emissions summary dispersion model. So they're trying to demonstrate and show what's the expected pollution that that facility will emit into the community and how much particulate matter it is. And so none of the other recommendations within that report specifically address that aspect of a business coming into a community and showing how much its production value will add to particulate loadings in that community.
So all of the information that we're going to garner with regards to the amount of pollution, what enforcement authority does the municipality have to deal with these issues when we find that they're significant?
Through you, Mr. Chairman, the bylaw would allow for, you could either get a financial penalty on a company. There could be other enforcement options. After we look at this, there could be something new that would be developed as this bylaw. Because the town of Oakville used, in terms of either a financial penalty or other type of action where council has to approve it, the town of Oakville, their council actually approves these applications on whether or not the company would be allowed to come in. So it is the actual council that would have the final say on whether the approval is given.
And how does that work when it's the Ministry of Environment that provides the authority with compliance documents, environmental compliance documents? I'm really trying to understand whose responsibility is whose and how we kind of step ourselves in.
Through you, Mr. Chairman, the issue of particulate matter is the one where it's a It's the contaminant of concern where there is an enforcement gap. There currently is no standard for particulate matter under Regulation 419, and that is the local air pollution regulation. This is where this bylaw comes in. This fills that gap on. It would allow the council to set that standard or have that approval of whether a polluter will be able to pollute to the level they're projecting they would.
I understand that, but it's the legislation that allows for the province to set those regulations. Since they have chosen not to set the regulation, where is it that we have the authority in law to set a regulation to deal with particulate matter?
Through you, Mr. Chairman. The rationale for the town of Oakville's bylaw came under a health rationale, whereas particulate matter is detrimental to health. And and I'm sorry if I don't get it all accurate here, on the Municipal Act will allow a town to create a bylaw, but it is built on the health rationale first and foremost, and then it goes into the powers of a municipality to create a bylaw.
So it's outside of the environmental regime completely?
Yes,
no
sir.
conflict with the province?
That is correct.
Okay. Look forward to seeing the document from Oakville, obviously. So I'm looking at the expenses, which is, I guess, Appendix A. And so I'm trying to understand, I don't know who made this page up. Is this coming from the task force, or is this a staff document with the projected expenditures?
Through you, Mr. Chairman, that is an appendix of the task force report.
Okay, so when I'm looking at those expenditures there and the expenditures that are in the report, is it the expenditures in the verbatim of the report that we're making the decision on, or is it projected expenditures in Appendix A, because they're slightly different?
Through you, Mr. Chairman, I would request that you use the report, the staff report expenditure estimates for that consideration. The estimates may be a little bit off in the AQTF action plan appendix, but when we try to look at how the recommendations could be adopted and implemented at the municipal level, that's where the financial recommendations in the staff report should be the ones that you're considering.
Okay, and so do we have a good understanding in terms of how many air monitoring units are required for us to, I mean, it's a big city, so I'm assuming we're doing air monitoring for the whole city, not just the downtown. How many air monitoring units will we be required to purchase to handle the entire city? Especially when we're talking about real-time observations.
Through you, Mr. Chairman, depending on who you ask, there could be a number of different answers to that. A lot of people would like to have air monitors. You know, you get calls from residents who want an air monitor put in the backyard just to see what their local pollution is. But in regards to the air monitoring request in this report, we think mobile air monitoring, and in conjunction with the use of an airshed model, would be quite useful in determining what our local pollution picture looks like. It would also use the Hamilton Air Monitoring Network monitors that currently exist. It would use the National Atmospheric and Pollution Survey sites run by Environment Canada. It would use that data. All of that information would be processed within this model to come up with an estimate for where we have pollution in our city. I'm not sure that answered your question, sir. We could have a lot or we could have a few, and so there is, I don't think you'll hear any advocate of air quality say that they have enough air monitoring.
I guess the challenge, Mr. Mayor, that I'm looking at is there's going to be an expectation in the community that they can receive this data in real time to know whether or not an asthmatic person could, ride their bike through this particular neighborhood at this particular time. And I can't seem to get a comfort level when I go through the report that that's going to
No, this report does not have perhaps the technical details of the air modeling that you might be requesting or looking for in this. But to put it another way, the model would be able to provide this information. It would even actually provide information on where we need more monitors. The modeling, the individuals who would help us with the modeling would be able to identify areas of Hamilton that they think the model could become more robust and complete with enhanced monitoring. So that would give us an indication again of where we should place monitors in the city. And to go back to your other point about real-time mapping, that is another separate type of project which is very cutting edge and it is very progressive, but it is something that members of Clean Air Hamilton are working on. Dr. Dennis Core is currently doing work pursuing development of a real-time air value map for the city so that people could look up their address and get, have an AQHI value associated with their neighborhood.
Okay, and with regards to Public Works submitting an enhancement of 20,000 for street sweeping and the 55,000 for education and outreach, how accurate are those numbers?
Through you, Mr. Chairman, the Public Works estimate was the one taken from their report submitted in September to the Public Works Committee, so that was based upon their report. And the estimate of promotion, the value that you see there is the yearly funding for Clean Air Hamilton. So we use those funds to do promotional outreach for air quality issues.
So was anyone here from Public Works? I was curious how much $20,000 actually buys us, because in my neighborhood it doesn't buy a whole lot in terms of the street sweeping. So
now, Councillor Roth wanted to weigh in.
Through you, Mr. Chairman, the Public Works report was already approved to go forward for budget consideration, but they had given two options in that report. One was enhanced, but it was looking at specific areas in the north end. It's really specific about enhancing certain areas around the industrial core. It wasn't about street sweeping outside of that area. There was no mention of that. So that's one of the things that we're trying to do through the task force, is to look at how can we bring forward through the Board of Health these types of issues in the future. So when we're talking about funding, I think this is a good opportunity for you, Mr. Chairman, to talk about this funding, because we wanted to try and highlight what the costs are of some of these activities. What's the ask that Public Health will be going forward with to Council for 2014, and what are the costs that are already incorporated into some of our budgets. So when you look at the financial staffing portion of the report, it's not asking for all of that money. There's various venues that we will be coming forward to, such as the capital budget requests that are specific to the airshed modeling and to the mobile monitoring. And so those requests have been put forward to the capital budget process. And we're glad to be able to go and talk to those at that process. But this gives us a really good opportunity to make some announcements about that, because with the airshed modeling, through the leadership of Chris Murray, we've been able to secure some funding to help offset the cost of the airshed modeling, and that the Hamilton Industrial Environmental Association has basically said that they'll come forward and pay up to $125,000 of that $250,000 cost to get this in place, because they feel it's an important part of it. That information came out last week, and I was hopeful to be able to bring it towards the capital budget. When the capital budget comes forward to capital budget consideration, you'll see that the amount requested is $125,000 in that report. And that Ministry of Environment has also stepped up and said that they are willing to put a $40,000 grant into the airshed modeling too. So the task force members have no budget. This is a subcommittee of Clean Air Hamilton, and so this is how we're trying to resolve this, by bringing forward information around where we can gather financial funding, and then how are we doing the education portion. That's through our existing budget. We're not asking for an enhancement or anything with that. We're looking at reallocating our existing budget to provide this kind of service. So I'm hopeful that that's helpful in clarifying that the only ask that we're going forward through this report itself is endorsement of the recommendations, but that the actual financial considerations will be done through the capital budget process and through the enhancement process for the Public Works, which is part of their operating budget decisions. So I hope that's helpful.
Well, it's a bit of a challenge for me because I'm trying to understand exactly what are the costs for this program, and you're telling me that there's no cost for this program, that it's spread out throughout the pie in the city of Hamilton. Is that a fair paraphrase?
Yes. Through you, Mr. Chairman. Yeah, there is no budget through Cleaner Hamilton. Because the task force in Cleaner Hamilton, we have a slight budget, I should say, through Public Health Services for the operation of Cleaner Hamilton. But these requests are going through the request channels that finance and administration folks said, you know, if it's a capital budget submission, you should put it through capital budgets and let that process unfold. Public Works made their submission on their street sweeping enhancement through their operating budget. The request was taken through the committee and through there. What we're trying to do is show you that there is actions being taken through various areas in the city that are contributing to the recommendations of this report. But this report specifically is not asking for that money, only the endorsement.
Okay, so from the governor's perspective, who's going to monitor all of these things and come back with a report a year or 2 years from now saying that all of these things have resulted in this?
Through you, Mr. Chairman, Public Health Services is taking the ownership of this whole area, and all of these reports we want to come through. So anytime there's an air quality issue, we would like to bring it to the Board of Health for their consideration. All of these recommendations in the task force, we believe, will require some council or Board of Health consideration and then on to council for approval. So it's our intention to bring these reports back to you as a Board of Health and to have your approval on them.
So if there's a concern in our community that the street sweeping is insufficient, that goes to where?
So Public Works is part of Clean Air Hamilton and part of the task force. So that's something that we can have recommended back through here. If there's a recommendation, because we're looking at this from a health perspective, and that we would like the Board of Health to endorse these recommendations going forward as positive actions to reduce the adverse health impacts related to air quality. I think it's through council's direction that if there's a financial impact on an operating budget in various departments, then those departments will have to highlight those through their budgetary process. But that we want the Board of Health to endorse some of these projects because it shows leadership in the areas of trying to reduce or eliminate any morbidity or mortality related to adverse air quality.
Okay, I guess, Mr. Mayor, the challenge I'm having then is historically a project would come forward with these recommendations, and here's the cost for these recommendations, and here's who's monitoring and dealing with it. So what you're saying is that these recommendations have no cost to it. Everything's being dealt with elsewhere, and you can't have it both ways. So either the costs have to be allocated here and shown that this is a part of this program, and other divisions are going to be implementing that part of the program, or it gets shuffled off to another division. So I'm really struggling here. I'm looking at, on one page, $406,000 in costs. And then I go through the document and I'm seeing things have brought down to $250,000 in costs. I don't know who to hold account for any of the expenditures. I don't know who to talk to in terms of, well, wait a minute, in Upper Stony Creek, they have a huge airshed issue with lots of dust. That's not being monitored here. It's a part of the ministry's monitoring, which no one's really thrilled with. So how do we, if this is going to be a citywide program to monitor PM, but it's only going to be happening below the mountain, how do we explain that to the rest of the city? Because they also have those issues.
Through you, Mr. Chairman. I guess I'm trying to explain that the Board of Health, we believe, should be the avenue for sending this through. I think if there's a recommendation that requires a financial cost, then and it's, let's say, goes on to the Public Works operational plan where they have to do something operationally, then that's a recommendation that the Board of Health can make through to the Public Works Committee. But I'm a little bit, I'm looking for clarity as to, I'd love to give you a yes or no answer or tell you exactly what it is you're asking me, but I'm not really sure, through you, Mr. Chairman, how to answer this question. I'm looking around going, does anybody else have any ideas to help me out?
Councillor Marula, would you like to weigh in?
I think simply what has occurred here today is that we have a report that's been formulated by a group of individuals that we created through a task force that are making recommendations to other departments of the city that doesn't obligate this council to any financial obligation, but obligates the council to deliberate about the particular issues. That's it. So there's no financial obligation. These are simply recommendations and not approvals.
Councillor Clark, will that satisfy you for now, or?
I'm sincerely wrestling with how we hold any of it to account if it's just getting passed off to the different divisions. Where's the program?
The budget.
With the greatest respect, $20,000 increase in the budget to street sweeping, how do we know, at the end of the day, what's the impact to air quality monitoring? Who's looking at, who's going to be paying for and looking after the actual air quality monitoring? Who's managing this project? It seems like it's a recommendation on health perspectives, but someone's going to have to actually enforce particulate matter if we go down the road of OPA. Who's managing this project?
So, someone, Rob, you want to follow?
Through you, Mr. Chairman. So when those reports come forward on these various action items, that's part of the recommendation will be who is the accountable department for this. So public health is leading the development of these policy areas. We'll be leading the development of various action items that come out of the task force. But there may be a recommendation in there that a new street sweeping, a new drag-out bylaw for particulate control on construction sites will be administered through municipal law enforcement, and that if there's appropriate funding required for that, municipal law enforcement will have to bring that through their budget process. I think what we're trying to do is set up the framework to be able to bring forward actionable items and then bring those back to this committee so that the Board of Health can consider and endorse those, and then send them on to the appropriate department for action. We're hopeful that this is sort of like an overarching plan for air quality in the city, but that everything will come back through the Board of Health, we believe, for your review. I know that, I'm not sure if that's answering your question through you, Mr. Chair.
I don't know how it'll come back to the Board of Health once those expenditures are set up with each of the divisions, because they don't report to you. So who's managing the program? Who makes the decision that, you know what, the street sweeping didn't work, we need another $40,000 worth? Who's managing that decision? It's not in this report. This report, this is doomed to fail if there isn't someone going to hold all of it to account. We all want it to work. Who's holding it to account? Who's going to make those decisions?
Through you, Mr. Mayor.
Yes, please.
So I think, Councillor McHattie said earlier about health taking the lead on the health, the health aspects of the issues that this council and community are dealing with, and that's what we're trying to do through this report. So when you think about air quality, the lead in terms of looking at monitoring and is there any impact to air quality, just as the air quality initiative has done for many years. That's done in partnership across the community and comes through the Board of Health in terms of reporting on impacts and what's changing and the recommendations about what more can actually be done about it. And so, we would see coming back, and indeed that does happen on an annual basis, looking at what is this year's report, what are the changes, what are we seeing happening. But the actual implementation of a specific initiative, like education, is going to be done by public health in combination with the task force and Clean Air Hamilton. The implementation of the bylaw, once it's developed, is done by the bylaw officers. The implementation of the street sweeping is done by Public Works. And so Public Works remains accountable for, did the street sweeping happen? Did it happen at the right frequency? Did it do all those things? But then the monitoring, the looking at how much of a difference is happening here in terms of air quality and the impacts it's having, still belongs with Public Health Services. And so decide that you want public health services to take over doing the street sweeping, to take over doing those different elements of it. But the piece of it, doing this collaboratively and having it seen as a whole picture where different departments contribute each piece that they can, that's what we're trying to bring to you here today. Financially, each of the financial pieces that relates to the obligations is spelled out where it relates to a capital request that's been made. It says that's the capital request that's in the capital budget relates here. Where it's education and whatnot, it's existing in our grant and services budget. And so we're continuing to go through that, and there aren't any new financial obligations.
Councillor, thanks. There's some profound issues that you've raised, and perhaps that discussion can take place at another time. But right now, we'll move on to the speakers list, and that's Councillor Whitehead.
Mr. Mayor, I guess I'm trying to grapple with the fact that things are not in our control. So, for example, I mean, there's an international body that looks at the airshed. There's a national body that looks at the airshed. There's a provincial body that looks at airshed. And then we have all the separate implementation of regulations and acts to deal with the smokestacks and the emissions and all those kinds of things. All those things are outside the control of the city and within the control of other jurisdictions. So the only real thing we have control of is, I think, what you identify as a particular matter piece. So it really narrows the scope of what we can and can't do. So I'm trying to understand on that piece. We already know where the problems are. We've gotten that through our studies. I mean, when I talk about construction sites, for example, we don't need a rocket science or air monitor to know that there's a real problem with this construction site. And it's intermittent. It's during a particular phase of construction, and it's pretty serious. I mean, I've had public health into houses and looked at the dust that's settled into the homes and the impact on very vulnerable seniors in those areas. I don't need the air monitor to tell me that there's a problem. People report it very quickly. So then I look at the other reports I've seen in the past in regards to the link, Red Hill, Queen Elizabeth Way, 403, in a particular matter that's created by all the high traffic and high speed on particular locations that we will have very little control over. So I guess I'm challenged in the context of we already know where the problem areas are that are within our control. We don't need really more information. We know the areas are outside of our control. I'm trying to understand how the implementation of these recommendations reconcile those issues.
Through you, Madam Chairman. Councillor, I agree that there are a lot of known areas where we do have particular problems in Hamilton, and it is to the areas that you've just alluded to, construction sites, and we know where there are problems. What we don't have, though, is an enhanced understanding of how much is generated from a roadway. We don't have that information. We think we know what the answer is, but we don't have that actual evidence. And it would be an interesting, surveillance tool to have an airshed that would highlight and do what's called source apportionment, meaning where's the pollution come from? Whose was it? Where did it generate from? Did it generate from a road? Or did it generate from an industry? Did it generate from a residence? This modeling will enhance that understanding, so we'll know who's contributing sectors within the city, who's contributing their share of pollution to this. I agree with you that we do have highlighted areas, and we've found just from complaints. We could do a surveillance exercise on mapping complaints from the community on construction sites. Fully in agreement with you on that one. That we'll get a call, and we do have a process now where we notify Public Works. Manager John Morganti gets after them on their upholding their agreement on the construction agreement that the developer signs with the city on get your water truck out. It isn't perfect, but it is something that is in place. We're looking to enhance those things too. So if the airshed model showed us in areas where they're currently developing that you need enhanced street sweeping, maybe in the future we would come back with a report showing that. It's like, hey, our airshed model told us that we need more street sweeping in other areas too. That could be a reality. It's just a hypothetical. That's the kind of information that the enhanced airshed tool would provide.
I just can't remember the last time the link was the street sweeper. I don't remember ever seeing the street sweeper on the link. I'm sure that takes place, but not,
Absolutely.
frequently as it needs to.
Through you, Madam Chairman, the link too, like a 400 series highway or a freeway like that, it's not only just the particulate matters, like there are other pollutants that will generate off of that, and it's through those cars coming through, and the trucking. Hamilton positioning itself as a logistics center will add to that, so we have to get more informed about how we make recommendations on transportation planning, transportation routes, and those things. So, to the end of the surveillance tool, it will give us enhanced information that we do not have currently. If that's the simplest way I could outline it.
I appreciate that. I think that's where I was driving, is that a lot of the stuff is already known. You're indicating that there's still stuff we don't know. So, you're the experts, and I like open and transparency in the context of the community, knowing that there's things taking place. I just, again, don't know the cost implication and whether or not we're very limited in the tools that we have to address some of these issues. I guess the next question I have then is, how is this going to be folded into other jurisdictions, such as the province of Ontario? What is the model we're looking at here?
Matt?
Through you, Madam Chairman. If this were implemented, I think there is interest from the province for this type of work. To get an airshed developed for a municipality and get an airshed model developed, that information could be shared with the province to allow them to understand better why we're looking at what we're looking at and what they currently regulate. There are some distinctions there. We're more concerned with, these initiatives are more concerned with the health impact angle. And so it's up to the province. I can't fully answer that question because I don't know how the province would react to that.
Yeah, I was just looking at the model, and I want to make sure it's integrated in some form or fashion, so I appreciate
Oh,
that.
for sure. We would want to use information that could be used by the province too, because I think there is strength in that when we work with them.
My last question is, I'm always suspect of a lot of social experimentation that's going on, so I'm trying to understand in this particular model, could we find ourselves in a situation that Clean Air says, oh, there's just too many cars on this road, so we have to find a way to get the cars off the road, maybe it becomes an anti-car?
Through you, Madam Chairman, I'm not exactly sure if it would ever get to that. It's on what you outlined as a hypothetical, but who am I to say it couldn't happen? But what the airshed model would, if it did show that transportation was a major contributor to pollution, it would certainly make us understand that we need to look at transportation closer and figure out how to address that problem. It might take the veil off of some unknowns, if you will, that's like, oh, that's where that loading is coming from, so let's get better at strategizing on transportation.
We also heard, because I asked specific questions when we had the presentation, that congestion also contributes to the air quality within the immediate area where all that congestion is taking place.
Yes, sir.
So I just want to, always looking at this and saying, okay, is there another game at play here in regards to this whole process? I understand it's pure in the context of what you're trying to achieve, but I'm trying to think of some of the underlying results that come out of it on a go-forward basis, and that's the area that I would be somewhat concerned on, unless it's, as long as it's a balanced approach, I don't have a problem. I'm not sure, because I haven't seen the plan, we haven't got there yet, but at least raise it now. That I hope there'll be a balanced approach to understand the economics of it, neighborhood quality, and so moving of goods, and all those kinds of things when we look at public health and recommendations. Thank you.
Thank you. And the mayor had down Councillor McHattie for the second time. Did anybody miss the first time? Okay, Councillor McHattie, please.
Thanks, Madam Chair. I just wanted to pick up on an item that Councillor Clark raised, the particulate matter bylaw. I think there was a good response to that, but back in the summertime, early in the summer, I heard about the bylaw. Councillor Algar is one of our counterparts in Oakville who has worked on that bylaw as a councillor. He and I got to know each other through being on Conservation Halt and other climate change activities. So we, Lisa Pasternak from Legal and myself and I think Marty Hazel was there from Municipal Law Enforcement thinking about the bylaw aspect of it. And we visited Oakville to learn about their approach. And obviously one of the key questions is how can a municipality to step into jurisdiction that many of us would perceive as provincial air quality issues. And they explained, Dr. Lucas was there as well, I should mention. Probably can explain this better than I can, but she's up there and I'm down here, so I'll have a run at it. That they went on the EBR, the Environmental Bill of Rights, and tried to push the MOE to take action on particulate matter. And MOE, through that process, MOE said, no, we're not taking action on that. And so it's wide open for legislative action on the part of the municipalities. And that's one of the ways they established the fact that they could act as a municipality. Because I think a lot of us would assume it's provincial jurisdiction. I was surprised when I first heard about it. That's why I wanted to learn more about it. And then I moved a motion back here a number of months ago, asking staff to now investigate the applicability to Hamilton. And it's come up through the task force recommendations here today. So that's good to hear. But it is an interesting role for a municipality to take. And Oakville's a couple of years into their implementation, and they've been successful so far, both from a jurisdictional perspective and not being challenged in any way by either the province, who hopefully wouldn't do that because they understand, but any of the industries that were subject to the bylaw itself. They've been working well with the town of Oakville. There's been no challenges on that, so that's been positive so far.
Thank you, Councillor McHattie. And thank you, Matt, for your presentation. Can I have a motion to accept the presentation, please? Councillor Pearson, Councillor Partridge, all those in favor? Carried. And now I'm looking for a motion to approve the staff recommendations. Councillor Marula, do I have a second, please? McHattie? Councillor McHattie? All those in favor for the motion to approve the staff recommendations, please?
Carried.
Carried. Any opposed? Councillor Clark has already voted as opposed. You now have before us item number 9.1 that was tabled at our last meeting. We can choose to lift that item from the table and consider it today, or choose to leave it tabled until a future meeting. What would the board like to do? Before we continue, I'd like to turn the chair over to the past Deputy Mayor, Councillor Jackson, please.
Yes.
This was tabled actually because I pointed out a few parks that were in my area.
Yes, you did.
One was specific to being privately owned. We have since, the staff and I have since worked out what part is owned and what part is municipal. And we'll just have to go further on to figure out how we're going to put the signage up so it's not too confusing for the rest of the public. But there was also two other parks that are not on there. Summerlee West just was built, and the one on Bellagio Avenue, and both being in Mount Hope. Or one in Fairbanks, the other one in Mount Hope. So I just want to put that out there for staff to continue with their list, because I know we're still compiling it as they're being built. So thank you, Mr. Past Deputy Chair.
Madam Deputy Mayor, back to you with Councillor Clark, as can be on your list.
Thank you. And that's who I've got next. Councillor Clark, please.
The other item that was brought up, Madam Chair, was Councillor Duvall had a trail that was indicated as a park, and I need to understand whether or not that item has been resolved with public health.
Kevin here? Is Kevin here? Kevin, did you get that resolved?
My apologies, through Madam Deputy Mayor, musical chairs here, in consultation with Bronzeville.
I'm sorry, I can't hear you very well.
Sorry, in consultation with Bronzeville, subsequent to the council's question about the corridor. The corridor still meets the definition laid out within the bylaw, given that the public is ordinarily invited there for the purpose of recreation, whether it be walking, riding the bikes, etc. And so we have not removed that from the schedule.
Councillor Clark?
Thank you, Madam Chair. You indicated your consultation was resolved, but did you have consultation with Councillor Duvall?
Through you, Madam Deputy Mayor, we did list properties subsequent to the November 18th Board of Health meeting. We corresponded with the individual councillors whose words were affected by amendments to the schedule, as well as the balance of council, should they have any questions regarding specific properties in their works.
My question was very specific. Councillor Duvall raised an issue here at the Board of Health. We tabled it with regards to his concerns, Councillor Johnson's concerns. You indicated you spoke to Mr. Zabel. Did you speak with Councillor Duvall subsequent to the Board of Health meeting?
Through you, Madam Deputy Mayor, no, I didn't specific consultation with Councillor Brian.
Then the matter should still remain tabled.
Okay, I'm hearing that the matter should still remain tabled, and we've got Councillor Farr seconding it.
Sure.
All those in favor? That is carried out. Thank
Just keep
you.
it on the table.
Keep it on the table. I believe, Councillor McHattie, you have a motion that you'd like to put before the board for consideration, please. 10.1.
Thanks, Madam Chair. And it's moved by myself, second by Councillor Jackson. And it's entitled Strategies to Address Cancer. And it really speaks to the Hamilton Spectator series that was done about a month or so ago, perhaps 3 weeks ago, on the differential impact of cancer on Hamiltonians. And obviously we've got an interest in cancer from a Board of Health perspective. And the Spectator series built on the previous series, you remember they had on poverty issues across Hamilton.
Councillor McHattie, sorry for interrupting, but before we put this on the table, I need a seconder, please.
I said second by Councillor Jackson.
I apologize, didn't hear.
Okay. So this is sort of the second installment in the Code Red series that the Spectator put together over a year ago, year and a half, I guess, or so ago. And it follows on the same theme that there's a differential in health issues across our city, and it follows along the lines of the low-income areas, and a number of concerns were raised. So the motion I have here today, seconded by Councillor Jackson, is asking Public Health Services to report back on actions that the city and the Board of Health can take to deal with issues raised in that Spectator Cancer series. And Madam Deputy Mayor, I had an opportunity to meet with Dr. Tran last week to talk about this, to get a sense, and one of the public health nurses whose name just lost. Thanks for that, Ellen. I lost my train of thought there for a second. And they outlined to me several programs that they're currently engaged in, which I think do precisely this, respond to the cancer series. And the one called CASTLE is the acronym, Creating Access to Screening and Training in the Living Environment, which does a number of screening things, gets at this differential health issue across the community. And of course, Kevin McDonald's work on smoking cessation. Kevin's, I was just at a conference last week trying to get sort of the state-of-the-art best practices review of smoking cessation. So we're already doing some good work. The motion here is to have a look at what was talked about in the Spectator series, report back to us on what they're already doing, of course, and then other activities that we might want to investigate here at the Board of Health. Thank you.
Thank you. And Councillor Jackson, you seconded this, and you'd like to speak to it.
So thanks, Madam Deputy Mayor, and I know that some people are going to see this as it's such a complex, complicated issue, cancer, and how you're going to deal with cancer. And there's so many, a multitude of factors, genetically, environmentally, lifestyle-wise, that may contribute to cancer and cancer-related issues. But you know what, Madam Deputy Mayor, I don't know about other colleagues of mine around this table, but I have, in my network, there are just too many people that currently have contracted cancer and or have died of cancer. And I'm not talking about people in the 80s, 90s, or in the 100s. I'm talking about people in their 30s, 40s, 50s, and maybe 60s. And it just seems I'm just attending too many hospital visits, too many funerals of people who have cancer. And so I thought with the timing of the Spectator series, and I as well met recently with Dr. Richardson to go over a number of issues, and this was one of them we touched on. Gee, we get involved, public health will get involved with head lice programs, we'll comment if a SARS outbreak occurs, Legionnaires, some obesity programs, right, for changing overweightness in our community, especially with our young people. And tobacco's an easy one. I read the series with the spec, and primarily public health comments were in the area of tobacco, and it's not good to smoke or be near secondhand smoke. You know what? That's now a 40, 50-year-old mantra that everybody gets, And I believe the population in terms of smokers in our society has gone from maybe 60, 70% 50 years ago down to, I think it's around, Dr. Richardson can correct me, around 20% now. So that was an easy one because that one has had so much play, media attention, societal attention. Everybody knows you shouldn't smoke if you don't have to smoke. Everybody knows that, or try not to be near secondhand smoke. And laws have come in play where now I don't have to worry about eating my steak in a restaurant, Madame Deputy Mayor, and somebody 40 years ago could have easily had their smoke, their secondhand smoke quaffing over top of my steak. Those days are long gone, and we've come so far progressively. But we've got a problem, and in my opinion, public health can somehow, maybe, play a greater role in our community from a public health standpoint to find out what's going on. You just have to visit the Jurabinsky, you just have to know that anywhere we go in our community, it just seems like to me that cancer is either there in a greater way than I ever thought it would be, and or there's something, some kind of factors, environmentally, lifestyle-wise, what we drink, plastic bottles, too many. I don't know. I don't have the answer, but I'm alarmed, and I'm just disturbed, and I'm just too many friends, people I know that are struggling with this. And I have people, I met with a lady recently who has just been told, and she told me, Tom, I do my yogas. I'm so careful what I eat. Healthy fruits, vegetables, everything, and doesn't understand. No family history either. And so it saddens me, and so I'm supporting and seconding Councillor McHattie's motion, not to create a mountain of work for public health with their limited resources, but I think there's a problem, and it's touching lives, and we've got cancer assistance programs and Cancer Society, walkathons, gala dinners, raising millions, billions, and something, in my humble opinion, is awry. There's something missing, and so that's why I'm seconding this, to see if there's some role in a more prominent way, Madam Deputy Mayor, that public health and Dr. Richardson's team can play. Thanks for your indulgence and allowing me to go on for a bit. Thank you.
Councillor White.
Thank you, Madam Chair. I guess it's not a treated issue. The reality is that we wish no one had cancer, and any prevention we could put right. And we know that, again, both nationally and provincially, there's many organizations that are doing research and making recommendations and so forth. I work in the community, Madam Chair, that we had a high cluster, we're talking cluster now, high cancer rates. And the majority of those cancer rates are people that worked underground at the uranium mine that would breathe in the dust, radiated dust, and they died shortly after or even before retirement of leukemia and lung cancer. And they're doing epidemiology studies to determine one of the causes and effects was in fact the work environment in which they worked. I also know that there's medications that people take that there's a bit of a risk as well, depending on their age, what type of medication they're taking. So it is a very, very complex issue. And I guess my concern is that there are easy things for our public health to go after, such as the things you've identified, that we can address immediately and have an implementation plan and so forth, within the capacity, the financial capacity and the workload capacity of our public health. The only concern I have is when we start going into an area such as this, and maybe I should ask this question first, have we determined that my understanding our hospitals serve 2.5 million people, so it's a larger regional area. When we're looking at the provincial average in cancer rates, where does Hamilton rank?
Through you, Mr. Mayor, I don't have the answer to that specific question off the top of my mind. From what I understand, the series in the Spectator was based on place of residence, but that can be part of our report back.
So I think it would be helpful, Madam Chair, before you go too far down this road in this particular motion, is you And this is what they did, and they do in many communities, is it's a cluster. So they look at where if there's a trend, a cluster is taking place, and you can start, like laser, you can start being what might be the cause and effect within those clusters. So I would hope that at the very least, by supporting this motion, we at least get that mapping done, to determine if there are cluster areas, and then perhaps look at the next stage, do a follow-up report. Is that practical to discuss?
Through you, Mr. Mayor, certainly there's going to be different groups of population that will have higher rates of cancer and have higher mortality rates. And you're right, Councillor Whitehead, that there's going to be certain geographical areas that have higher rates as well. So we certainly, when we look at reporting back in and finding strategies that address cancer, you want to prioritize your resources and your strategies to whether it's geographic areas or specific population types, whether it's low income or neighborhoods or demographics that have it to address the issue.
So let's go up to the chair now. What I'm looking at least at the first stage of this particular motion is to at least see if we can map out the geographic clusters, demographics, and so forth. Is that how you would see on a go-forward basis and report back with that data, and then perhaps put an action plan together at that point?
To you, Mr. Mayor, we'll certainly categorize any results based on the type of cancers and generally do some sort of analysis in terms of which groups have the higher rates to address when we're looking for moving our strategy forward. We'll look more specifically, we can define any geographical mapping. Sometimes we have that information, sometimes we don't. So that'll be based on data availability as well as some statistical issues, because if you have areas that have low numbers, then it is harder to make statistical comparisons. So we'll try to do certainly analysis that based on demographics and geographics that's dependent on our data and how reliable that data is.
I appreciate that. And one of the things I mentioned, Madam Chair, is the fact that workplace, certainly in the case I identified, to be contributed to those clusters, regardless of geographic where you live. If you have predominance of people working for a particular industry, you might find higher level cancer rates through that industry. Is that correct, Mr. Chair?
Through you, Mr. Mayor, there are certainly additional risk factors other than demographics, and the type of work that a person does may affect the risk of certain diseases, including cancer. So that's something will be under consideration.
Okay, and my last question is and this is to Dr. Richardson, by marking on what is being asked of us in this particular motion, do you have the staffing and resources to act on without any additional money?
Through you, Mr. Mayor, I think what we'll do first is come back and give you an idea of what we're considering in terms of moving forward, because I don't think we may not necessarily be on the exact same page in terms of what it is we're thinking of doing as a result of this. We're really looking more at some epidemiology of cancer, and then looking at what are some ways that people can reduce their risk of cancer. But we're not looking at individual linked data that would look at a particular workplace and how it might be tied in. Those are studies that are absolutely massive, millions of dollars in order to produce them, and it's not what we have the resources to do. So we'll begin by coming back with an outline of what we're going to be doing.
Well, I guess the obvious question is, do you support moving down this road?
Sorry, Mr. Mayor.
Do you support, my last question is, are you supportive of taking on this additional responsibility?
Through you, Mr. Mayor. Yes, absolutely. The prevention of cancer and health promotion related to issues that lead to cancer is absolutely part of our mandate. And so we would, as we do today in terms of cancer prevention, see bringing back a report around this as part of our mandate.
I have Councillor Clark and Councillor
To be honest with you, it is open-ended, obviously, in the way that it's phrased. And my intent was just to be able to respond to the Spectator series. It was quite alarming. I read the whole series. Quite alarming in many ways, as was the previous Code Red series as well. So, given that it is open-ended, I certainly support Dr. Richardson's response a moment ago to Councillor Whitehead's comments that she should really come back to us with a scope, with a sense of where they want to go on this. There's a number of things that they're already doing that I learned from Ellen and Dr. Tran last week. So they can certainly talk about the things they're already doing that respond to this. And then maybe a scope of the kind of things that they would do from there on. There are only certain cancers that they have responsibility for as compared to the Ministry of Health and the hospitals and that sort of thing. And other ones that they're not involved with. Skin cancers and issues, an example. Lung cancer is an issue they deal with. Breast, cervix, and colorectal cancer, they work on those particular cancers. So if we were to ask them to work on some other cancer that is not their jurisdiction, that'd be problematic. It would be costly, and it would be duplicating work that's already underway at the Ministry or through Hamilton Health Sciences or elsewhere. So I think reporting back on what we're already doing, which is important for us to know, some of it, which I think deals directly with some of the concerns raised in the SPEC cancer series, particularly the differences amongst neighborhoods, and then a bit of a scope of work if there's additional work before, back to us, before they would just move ahead. They'd seek direction from us. Mr. Mayor, that's what I intended as with the motion.
Thank you. Mr. Mayor, can I ask Dr. Richardson, this Cancer Ontario, what exactly is that organization?
Through you, Mr. Mayor, Cancer Care Ontario is it brings together an oversight of the cancer treatment system as well as research and prevention and promotion to some extent for Ontario as a whole. And so there are some of the preventative programs are run through there, much of the treatment, much of the research is all done through that organization, and it links in with the local cancer treatment centers, so the Juravinski, other ones. One of the things just to note is that we do have Carol Rand and people from the Juravinski coming back. I think they're coming to either January or February's Board of Health meeting to talk more about the cancer treatment issues that the councillor had raised earlier. And so that will be coming back, but not specifically part of this report.
So is it possible then that we get, I think, a more holistic response to what Councillor McHattie is speaking to, and that is what the municipal role is within the medical officer health, dealing with public health issues specifically, the ones that we are responsible for in terms of promoting prevention and helping people through that. Having the Juravinski Center speak to us about the cancer care, the issue with regards to IV drugs versus oral drugs, the cost of oral drugs that people are having to deal with. Perhaps have Cancer Ontario deal with the larger issues in terms of efficacy of some of the medications and all of the other issues that were in the Spectator series that would fall outside of your jurisdiction, so that we get a more rounded response to it. I'm just cognizant of not really keen on having our medical staff and public health going out and grabbing stuff from Cancer Ontario and pulling stuff in. When they've already got the material and they work with it every day, they could probably explain it a heck of a lot better to the councillors. Let's deal with the ones that have the responsibility. So, Dr. Richardson, you have a responsibility for certain things. Report back on what you're doing on that. Have Juravinski Hospital report back on what they're dealing with. And Cancer Care Ontario report back what they're dealing with, and then leave it to the board of directors here to ask further questions in terms of what's actually happening to our residents. Does that seem rational?
To you, Mr. Mayor, yes, this seems like a good approach. And I think with the Juravinski coming, that can be the beginning of that.
Okay, thank you.
Thank you, and thank you for clarifying the scope. That was where I was really headed to as well, because I know that the Spectator basically focused on residential, and I think we can all agree, we know people who live outside the city but work in the city and have the same issues. So I'm really glad that we're getting some sort of a scope there. And I want to thank Councillor McHattie for bringing this forward. You know, it's near and dear to my heart, so it's, and you realize that when you are into that arena, you find out how many other people are also in the same boat, so thank you very much.
Any further speakers? Councillor Clark.
So just suggesting perhaps a friendly amendment that we would include a report back from the Geriatric Hospital, which we're going to get from Cancer Ontario, so that we're getting the whole picture for Ontario to help us with some of the discussion.
Okay, to take the chair, Councillor.
Yes, sir.
The newspaper has a job to do. Their issue is to sell newspapers, first and foremost. And I would be surprised that if they held any data or information or came across it, that would be a surprise or news to our staff. We have all the mortality rates, for instance, the 189 respiratory cases. You look down through our data and you see that against Ontario, we actually have a lower rate of respiratory deaths due to respiratory illness. So I don't know where that 189 comes in, but what I'm trying to say is that we are the repository of, and we should be, of a tremendous amount of data. And so a very interesting story comes forward. We all read it with interest. But I'm not sure whether we should be dealing with issues raised in the cancer series when we're dealing with cancer issues and obesity issues and addiction issues and all sorts of issues. I just feel to be spurred on by, media publishing. Not that that's never happened or these aren't important, and I'm not being demeaning at all, but I'm just surprised that we would require our staff to spend time and money on things that they're already dealing with or should be dealing with on a daily basis. So I'm not sure. I'm willing to support asking our staff to do anything more based on whatever was published in those series. So those are my comments, and I'll take the chair back. And so we have the, any further speakers? Councillor McHattie, did you want to speak again? I thought I had you on here. Okay, we're done. So on the motion, it's moved and seconded. All in favor? Are there any opposed? I'll be opposed to that. And that's it. Now, we have a private and confidential matter before us. I need a motion to go to closed session as is pursuant to subsection 8(1)(b) of the city's procedural bylaw and section 239(2) of the